of the spermatozoa through the female reproductive tract to the fallopian tubes. After that, arrival of the recently ovulated ovum is the place where will be fertilization. After that, fusion of the gametes and formation of the zygote and migration of the zygote through the fallopian tube inside the cavity of the uterus. And the final step is the implantation of fertilized egg inside the functional level of the endometrium. And inside of any step, each step of that process could be mistakes. And that is why very difficult to understand where is this mistake. And we need to find it. And breaking trouble with any step of that requirement can result in the formation of infertility. How to classify infertility? No, in the beginning, of course, could be primary and secondary. If person was pregnant before, and if she get trouble with the fertilization, that story will be named secondary infertility. If a couple who have had no previous pregnancy, if we are talking about the couple who have not no previous pregnancies, we are talking about primary infertility. And sometimes we have absolute female infertility. Possibility of pregnancy is completely excluded because of surgical sterilization, for example. Hysterectomy was made, or menopause. That story will get the name absolute infertility. Inside of the structure of the couple infertility could be meted female and male, most favorite types. If we can find the reason for the infertility, we can name it unexplained. And take a look for the statistical information, guys. 50-50. One more time, don't think that infertility is only female trouble. No, of course not. We are talking about the combination trouble, which can be like for the one side, like for the other side. And male and female can meet the trouble with infertility, and the possibility to get the pregnancy could be because of male too. And very often I can meet the persons who tell, I don't know what you're talking about, I'm free of trouble in the female trouble. No. First, you like a doctor need to explain, guys. No. Male should be checked anyway. What kinds of reasons for the male infertility can be? It's not very difficult. That could be pretesticular reasons, like you see at the screen. Could be testicular reasons, and could be post-testicular causes. Very easy to memorize, and please do it. You need to get small information. You need to get. If we are talking about female infertility, inside of that story, there are many different reasons. Don't forget that the migration of the spermatozoa goes through many parts of the reproductive tract for the female. And any factor could be affected. Any place could be affected. Don't forget that the region of the ova is the result of the normal menstrual cycle. And mistakes inside of that regulation can formate infertility because of absence of the releasing of the ova. So could be general factors. Diabetes can play a role. Yes, can. Psychological factors. Yes, because cortex play a role in the formation of the axis of regulation. Hypothalamic pituitary factors. Yes, of course, because hypothalamus and pituitary gland play a serious role in the regulation. Ovarian factors. Absence of the ovulation, absence of the ovary, anovulate, chronic anovulation, adhesions at the surface of the ovary. Tubal peritoneal factors, the formation of the adhesions inside of the tube due to endometriosis, pelvic inflammatory diseases, tubal occlusion, result of the surgery or something else. Uterine factors, cervical factors, vaginal factors, genetic factors. Any place of reproductive tract for the female can be the reason of infertility. That is why favorite story, favorite information that you need to memorize. Reasons for the female infertility, no, very many. Not less than 200 disorders can promote infertility in the female. And that is why our management should start from the male. Why? Because one more time, we have only pre-testicular, testicular, and post-testicular reasons for infertility. And actually very easy to formate information, to formate our knowledge about possible, about such story, like able that person get the normal to be fertile or not. How to do it? Spermatogenesis, guys, spermatogenesis. And we can check that spermatogenesis with help of spermogram. And if our spermogram after our management will be normal, our conclusion will be that man able to be fertile. And we can start to work with the female. Only after that. I'll tell you what we're gonna do with the female, what you will see. For the male, it's not very difficult. Spermogram. And we have criteria for the normal spermogram. You can find that criteria everywhere. Should be normal volume, should be normal pH, should be normal concentration. Motility of the spermatozoa should be normal. Morphology should be normal. And absence of the white blood cells should be inside. And it will be enough to us. Yes, that man can be fertile, can get a child in the future. Only with help of one method of investigation. If the result be abnormal, of course, we need to talk with him, with urologist, but it's not very difficult actually, guys. So, impossible to work with the man. For the females, not like that. What we can find, guys? Now take a look for activity of the spermatozoa. No, could be like that. High amplitude. Could be like that. Abnormal amplitude. No? Could be abnormal structure of the spermatozoa. Could be different disorders. Could be oligospermia, could be normospermia, could be azoospermia, aspermia, could be astenodospermia, teratozoospermia, different disorders. But anyway, the not part of job for andrologists, not for us. But you, like doctors, need to imagine. And believe me, maximum couples try to start her way inside of the trouble for infertility from gynecologist. And we need to formate correct information inside the mind of them. You need to tell them, guys, first you need to check spermogram. No, sperm morphology. Postcoital test we can do, no, seminal plasma and so on and so forth. We don't need to formate big knowledges in your mind for that, but just if you want, you'll find the information about trouble. We have such story like unexplained infertility. No, it's a difficult part of the knowledge inside of my mind. Because no, for me, everything should be explained. But sometimes we can't find it. We can't find it. No, guys, what kinds of trouble can be that? Egg is not released in the optimum time. Sperm is not able to reach the egg. It's normal, but not enough for the concrete egg. Different troubles with the transport of the gametes or zygote. No, we don't know. We don't know what are the reasons. We found it was trying to find everything. We didn't find the reason. In that case, we need to talk about unexplained infertility. And only after checking of the male, we need to start to work with the female infertility. And we continue our conversation about after the break. Make a break, 5-10 minutes. We will start soon. Continue soon.